Oh, I'm Andrew Chong. I'm 63 years old. I'm from Sabah, Kuala Kinabalu. I used to be a scuba instructor. Okay, in 2009, I did a checkup in Kuala Kinabalu in one of the clinic, and the doctor told me that my uric acid, that is triglyceride and cholesterol, is high, and blood pressure is a bit high, although borderline. So he gave me some medication, and of course I didn't take the medication. I'm not going to take the drugs. And in 2017, around May, when one of the hospital in Kuala Kinabalu, they have a promotion to do the blood test. So I went for my blood test, and when I get a result, they refer me to a cardiologist. They said I got a suspected heart problem. So when I see the cardiologist, he said, well, we have to do a angiogram to check whether you have any blockage or not. But according to your result, it looks like you have blockage. So I said, no, I'm not going to do it. And so he prescribed some aspirin for me and asked me to come back 1 month later. And 1 month later, that is almost June, end of June, I went back for a review. So he said, well, have you made up your mind? Do you want to do the angioplasty? I said, no. I said, if you want to do it, if we find blockage, we'll put a stent. I said, I don't want a stent in my body. So he gave me aspirin again and gave me another medication for the heart. And after that, September 15, around 3:30, I went in the government hospital to have a check on my chest. I have a mild pain on my chest. I was admitted at 3:30, and the doctors there did a check on my heart. They did 4 angiogram. 4, no, sorry, not angiogram. Something to check the heart anyway. I can't remember the name of it. After four check, they discharged me around 9:30. So they said, okay, after you discharge, you come back 2 days later to register, and we'll send you for further tests. When I register, that time is about what? The waiting list is until next year, January the 9th. So anyway, it's a long wait. And later on, around almost end of September, one of my friends recommended me to another specialist center in Kuala Kinabalu to have a second opinion. You don't want to do a bypass, you don't want to do a stent, there's another alternative. So I went to consult the doctor again, and this doctor, of course, they said, look, there's no other choice, you have to do a stent. Your case looks serious. So I show him the CT scan which I have done. Also in another clinic or hospital rather in Kuala Kinabalu. And they say, looking at it, well, you have 2 blockage, okay, 50%, the other one 70%. So I suggest you better do an angiogram and we'll put a stent. I'll book you on the November the 7th. On November the 6th, I have 2 patients. So anyway, I said, let me think about it. So I go back, I go into YouTube, I search. In the YouTube, I look for EECP, that's an alternative. And seems that there is another alternative for this blockage. So I go through the YouTube, and finally I read more on this Heal Within by Dr. Lee. So I look at his talk on the YouTube and some of the testimony. So I said, well, this is a solution. I may give it a try. Why not, you know? After all, I don't have to put a stamp. So I decided to make up my mind and come to Heal Within and consulted Dr. Lee on October. When Dr. Lee did a test on me, he said, well, you have to do some detoxing, colon detox, liver detox, and blood detox. That is 15 days. After the detox, then you come back for review. Then only that we'll do the EECP, which have come back in November the 7th. And for the EECP, it takes 35 times. Because we only do it once a day. So today is my second last day for the EECP. Tomorrow is my final day. Well, after taking all these supplements and follow the programs, I find that my health has improved, right? Like when I first come to see Dr. Lee, I said I have a shoulder pain. You know, my right hand, 2 fingers were numb. Right? For the past 6 months, it was numb. Then followed by both hands. When I sleep, they are numb. And my right hand, I cannot close. You know, I have a problem. So he said, well, you have to do another detox and do the EECP, right? I think it's almost 5 weeks. I did find improvement. Now for us to get well, of course we have to be very committed and disciplined to follow the program, right? This program, of course, I have a crash course because I got so many problems, okay? High triglyceride, high cholesterol, high blood sugar high, and liver, high toxin, even the blood. So anyway, after doing 5 weeks of this program and taking the supplement, I find that I have improved for such a short time. Right? Before that, I can hardly walk 15 minutes or even up to 2nd floor. I'm always short of breath. And my friends who are with me, they know that. So when they see me on my 4th week, they are surprised. They ask me. So I said, well, I'm not a doctor. If you want, you ask the Dr. Lee. He will give you more details. So I'm still on the program and taking the supplements. And for friends up there or out there who want to take up this, bear in mind, you have to be very committed, you have to be very disciplined and follow the program. The doctor and the staff here is only to advise you, to guide you. Now, if you are not committed, right, to take the supplement and to follow the program, they can't help you much. If you don't help yourself, how do you expect them to help you? So, just be patient and get committed. It is for your own wellness. Thank you.